I've done my MBA. I passed out in 1993. So in those days, there were very few women who went into business administration. Then I went on to work for Max New York Life Insurance. We started working in their sales team. It was there that, the pressure started getting into me, and I slowly started having headaches. Then it started occurring more frequently. Every week I'd have a headache. Then every 2 days, and I was popping in, this paracetamol so much. It actually affected the kidneys. So that's when I went to SMF, Dr. Shanta. She was such a wonderful doctor. I went in such a precarious stage to her. She helped me survive, and she delivered my baby, who was a preterm baby. Anju was delivered in 8 months itself. At that time, Dr. Shanta told me, your kidneys are not functioning to the full, so you need to take medication for it. With a small child, your focus is so on the baby. I used to forget taking my medication. And after the whole day's work, I'll go lie down, and then oh God, I didn't have my BP medicines. I was very careless, and I think that was one of the biggest faults that led to kidney failure for me. I started feeling very tired. I'm normally a very active person, buzzing around the house, and I used to keep lying down, and sleeping a lot. So my father-in-law noticed this and said, she's normally not like this. So why don't you take her to the doctor and check it out? So we first went to the gynecologist. She found me severely anemic. She said, why is this happening? Because I was taking good food. Just after delivery, I was feeding the child and everything. And I was taking rich food, and yet I was very, very weak. So then they said, let's take a few more tests. And that's when, we saw the urea, creatinine. These levels were on the rise. Creatinine has to be below 1. It should be just 0.6, 0.7 in normal people. It had already crossed to 3.5 at the time when we checked out. So then the doctor said, no, this is not a right thing, so you've got to go to a nephrologist. So that's when we came to Dr. Georgie, and he checked out and he said, yes, it's not such a great scenario, but we will try with medicines, to keep you at this level at least. I was having the medicines, and there's a lot of water retention started happening, and it started happening on my chest. So I could not breathe easily. And when I lie down, I can't breathe. So it started slowly. The third day of the water retention, I had to sit and sleep. Dr. Georgie said, no, she needs to be put on an immediate dialysis, hemodialysis, to remove that water retention.
Shanti is an incredible woman. She is my dearest patient, whom I have been taking care for the last 17 years. Kidney disease doesn't have any symptoms. It is a scar in the kidney, which is slowly progressive, irreversible, and often asymptomatic in early stages, unlike any other system in the body. So unless you target a population who is prone to develop kidney disease, for example, diabetics, those who have high blood pressure, those who have heart disease, those who are taking alternative medicines, and there is a family history of kidney disease. These are the targeted population. You should be checking their kidney functions to make sure that they do not have kidney disease. And those who have kidney disease extending beyond 3 months, we call it as chronic kidney disease. Chronic kidney disease requires constant care and advice to the patients, because a lot of the people do not know the existence of chronic kidney disease. 17% of the Indian population, they have prevalent chronic kidney disease. So when you have kidney function which is less than 10%, both kidneys functioning less than 10%, You have to educate the patient. You should start a little early itself. Tell the patient, okay, you are progressing to terminal kidney failure, or we call it as end stage kidney failure, and you have to plan your treatment. We have about 62 million diabetics in this country and another 60 million who are pre-diabetic. So it is presumed that 1 in 2 or 1 in 3 diabetics will develop diabetic kidney disease. So every diabetes patient, when they have a diagnosis of diabetes made, they should have their kidney function test also done. And this is not happening in this country. She had chronic kidney disease and she is on peritoneal dialysis. We call it as continuous ambulatory peritoneal dialysis, and which is a form of kidney failure treatment offered to patients all over the world. The advantage is that it is a 24-hour, 24/7 treatment. So the poisons are being removed continuously in peritoneal dialysis. So they have more relaxation with regard to diet, water intake and salt intake. Whereas in hemodialysis, you have seen that they come for dialysis, they lie down there for 4.5 hours, they are dialyzed. The moment you stop the dialysis, again the poisons are accumulated. It is like a seesaw pattern. Goes down at the end of dialysis, then it comes up. Whereas in the continuous ambulatory peritoneal, it is a flat line regarding the poison removal as well as the water removal. Honorable Minister Harshavardhan made a statement saying that peritoneal dialysis should be equally important as hemodialysis. So this new progressive policy, which I was dreaming for the last 29 years, will help us to access peritoneal dialysis. A lot of people in the country, in areas where they can't have hemodialysis, or somebody who cannot have hemodialysis for health reasons. Options for somebody who wants to continue to work and have a freedom from a machine, they should go on continuous ambulatory peritoneal dialysis because they have the choice of home therapy. At the same time, if they want to travel, there are distributors across the country and in South Asia. Suppose, for example, somebody wants to travel from Chennai to Delhi, and you can tell the distributor, I need the dialysis fluid there in advance so that it is ready for them and it is supplied to them so they can take care of that rather than carrying dialysis fluid in a plane or in a train. So this is easy in our country now. The access is easy.